Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication known as clonazepam, very similar to a medication, lorazepam, that we talked about in a previous episode. Before we get started, just keep in mind, as always, that this channel is used for information purposes only, and it's not meant to be a source of recommendations for your personal health care. So as I mentioned, clonazepam does fall in the class of a benzodiazepine. These are typically known as being used for anxiety, but each medication in this class does have different indications. This one is commonly seen in seizure disorder, for example. So benzodiazepines in general bind to benzodiazepine receptors in the body, which act as a specific binding site for GABA, which is the gamma aminobutyric acid neurotransmitter. This neurotransmitter is the main inhibitory neurotransmitter in the CNS. Before an individual was to use clonazepam, there are a couple contraindications or reasons the medication should not be used that they should be made aware of. So it should not be used in individuals who have myasthenia gravis, and it should also be avoided in individuals who have closed angle glaucoma. But it may be used in patients who are receiving appropriate therapy for open angle glaucoma. These two contraindications are more specific to the benzodiazepine class in general. There may be added contraindications for clonazepam specifically, and you would just consult the drug monograph to find this out. Aside from contraindications, there are also some precautions that should be taken when using this medication. Elderly or debilitated patients, patients with low serum albumin, and patients with liver disease seem to experience the most CNS side effects. To minimize the effect of ataxia, dizziness, and oversedation, it's often recommended that people start this medication on a very low dose and slowly increase it to, again, the lowest possible dose that'll help them with their symptoms. Benzodiazepines in general can produce prolonged CNS depression in neonates because they lack the ability to convert the drug to its inactive metabolite in the body. And reversible dementia has been detected in elderly patients on a longer course of benzodiazepines. When comparing short-acting benzodiazepines to long-acting benzodiazepines, it seems that the long-acting class has a greater risk to elderly patients in terms of falls, which could lead to things such as hip fractures and hospitalizations. Therefore, we should generally try to avoid long-acting benzodiazepines for the elderly patients. In this population, it's very important to individualize the medication therapy and also individualize the monitoring plan because some people will need increased monitoring. Serious behavioral changes and abnormal thinking have been reported with benzodiazepine use. These could even go as far as hallucinations. And lastly, because of some isolated reports of blood dyscrasias and abnormal liver function tests, it isn't a bad idea to get liver function tests done and some blood work if you're on a long-term benzodiazepine. In terms of dosage of clonazepam, for anxiety and panic disorders, we often see 0.25 milligrams to 0.5 milligrams taken twice a day. And for seizure disorder, we often see a dose of 0.5 milligrams taken 3 times a day. And then that dose could be increased by 0.5 milligrams or 1 milligram every 3 days until an appropriate dose is reached. The maximum dose in this case, again talking seizure disorders, would be 20 milligrams a day. After the dosage of clonazepam is taken, it reaches its peak concentration in your bloodstream at about 1 to 2 hours post-dose. And the half-life of clonazepam, or the time it takes for the concentration in your bloodstream to decrease by half, is 20 to 80 hours. In terms of side effects, the most common with clonazepam are dose-dependent CNS effects. So this could be hallucination, oversedation, general fatigue, or just something as simple as lightheadedness. The fatigue that most people experience could potentially decrease over time if you are using the medication consistently, but oftentimes people will experience that fatigue. Some serious side effects, but not too common side effects, are hypersensitivity reactions, mental depression, behavioral disorders, jaundice or hypotension, memory impairment, or a venous thrombosis. Some side effects that have come up from time to time but are very, very rare are abdominal or stomach cramps, blurred vision, constipation, diarrhea, or some sexual dysfunction. If somebody developed impaired coordination or lethargy, diminished reflexes, or confusion, they could possibly be experiencing an overdose and should be taken to the emergency room to be checked out. That's all we're going to talk about here today with clonazepam. I apologize for the lighting and whatnot in this new room I just kind of put together. I'll try to get it set up better for the next video. Keep in mind, as always, like I mentioned at the start of the video, all videos are just for information purposes only. Don't use these videos as a source of a recommendation for your personal health care. And if you like the videos and want to help see the channel grow, you can like the videos or share the videos. Don't be afraid to leave a comment if you'd like to request a medication in the future. That's all for today. Take care.